back on Ignorance Soch's ttalk Train of Thought with a series of an episode with Dr. Anil Bradoo. It's a great insight what we have got only on exclusively on ttalk Ignorance Soch. Sir, a great insights of your journey as far as urology which is concerned, and you have been the past present of various associations which are there. Now, in fact, for the benefit of an target audience, like what is urology?
Well, urology is a super specialty which deals with surgery of the organs which are part of the urinary tract and the genital tract. So when I say the genital tract, that means with the male sexual function and male fertility. So that's why it's called as a urologist and andrologist. Mm-hmm. So andrology takes care of the male sexual function, male sexual organ, male genitals, and the male fertility. It is the counterpart of gynecology, as we know, in women. So the male counterpart of gynecology is part of urology. The rest is the urinary system, starting from the kidneys, where the urine forms, till the tip of the urinary passage from where the urine exits. So everything in that organ, right from the top. So we know there are two kidneys which form the urine, and there are tubes which connect. That is a 26 centimeter long tube which connects the kidney to the urinary bladder, which is a storage organ. The urinary bladder in males is at the exit surrounded by a gland called as the prostate, which is a very, very, very notorious gland for everyone like you and me who's beyond 50s.
Yes.
And then the urinary passage, which is called the urethra. So this is all part of the urinary tract and common to males and females. Of course, females don't have the prostate, but till bladder and then the urethra is common. And the genital tract, where the testicles, the epididymis, the vas deferens, the seminal vesicles, all these are part of the andrology treatment. So this is what urology. And what urologists do per se, they are specialists in the surgical branch. So they will take care of all surgical problems or obstructive problems in the urinary tract. Why I'm saying so is because the medical aspect of diseases of the kidney is dealt by physicians in that branch, which is a super specialty in its own way called the nephrology. So nephrologists are physicians who take care of the medical diseases in the kidney. So when I say surgical diseases, that means things like urinary stones, things like bleeding from the urinary tract, things like obstruction to the urinary tract, things like cancers in the urinary tract, things like prostate enlargement, things like difficulty in urination, all forms of difficulty with stoppage of urination, frequency of urination, or the control of urination. All this is part of urology.
Nice. And so what is the most challenging aspects in urology?
Well, urology is a very, very evolving branch. From when I qualified in 1992, which is almost, you would say, 30 years ago. To what urology is today, from open urology, that means when most of the operations were done by taking an incision, opening the abdomen, or going in the retroperitoneum, and structures in the urinary tract were treated with an open surgical technique, to endourology, which is endoscopic. That means you have a telescope with a camera which can go through the normal urinary passage into the urethra, see the urinary tract, the prostate, the urinary bladder, go through the orifices, the ureteric opening into the bladder, through the ureters, reach up to the kidneys. That means from the tip of the urinary passage to the kidneys, you can have small telescopes with cameras which can go, enter and do their job and come out. That is called endourology. So miniaturization of instruments has taken place over the last 2 decades. And now you have very, very small instruments. You can imagine a 1.5 millimeter telescope goes through the urinary passage and reaches right up to the kidney. And you can treat your stones, your tumors, your obstruction, all with endourology. Similarly, lithotripsy, what we call as extracorporeal shockwave lithotripsy, or stone broken by a machine because of shock waves, was one of the first inventions in late 80s, early 90s, which could treat stones without any invasive treatment, only as an outpatient treatment with a machine. To lasers in urology. Lasers are light amplification of stimulated emission of radiation. A small fiber goes through an instrument, reaches the target area and breaks or removes that area with only laser energy. So it's such refined processes. This all happen through endourology, and you have laparoscopy with small keyholes made either to enter the kidney with what you call as a percutaneous procedure, or keyholes in your tummy to enter into the abdominal cavities. And from those keyholes, with cameras and magnification, you can remove organs, diseased organs, you can remove tumors. So that is called laparoscopy. And now robotics.
No, robotics.
So robotics assess you to do the laparoscopy techniques in a more refined way. So in last 30 years, there's so many advances in urology that, urology is one of the most sought after surgical specialties as a super specialty.
Correct.
So when you know that super specialties are in plastic surgery, in cardiovascular surgery, in neuro, brain surgery, pediatric, only for children, and in urology. From these 5 super specialties in urology, urology is one of the most sought after branches because it offers you a lot of variety, basically. Let's put it. There's a lot of subspecialties in the super specialty. And you talked about andrology, you talked about male infertility, you talked about reconstructive urology, uro-oncology dealing only with cancers, pediatric urology only dealing with children, female urology, urogynecology, endourology, transplants, even kidney transplants are part of urology. So all these subspecialties are part of urology. It's a wide range, and you can really enjoy the learning as well as the practice of urology because of such a wide spectrum available.
So what are the most common cases in urology?
Well, the commonest problems you will hear of in urology are to deal with your day-to-day problems, which is how you pass urine, whether you're passing urine with a good flow, whether you're not passing urine frequently, or whether you're passing too frequently, or you have an urge to pass and you cannot hold, or you get what you call as repeated urinary tract infections, when you have burning, you have pain while passing urine, and blood in the urine, pus in the urine, or passing altered colored urine. These are the common problems, and the commonest causes are urinary stones. We all know kidney stones is a terminology used so often. So the stones form in the urinary tract, and it could form right in the kidney, in what is called as this terminal portions of the drainage conduit of the kidney called as calyx. And they could be in the calyces, in the pelvis of the kidney, in the ureters of the urinary tract, in the urinary bladder, anywhere. That is common. Similarly, obstruction, blockage to the urinary tract because of various causes also is not an uncommon problem. In males, after the age of 50, prostate and what we call as lower urinary tract symptoms are very common problems. And as I said, bleeding in the urine because of cancers in the urinary tract. So you could get a cancer in the kidney, you could get cancer in the drainage system of the kidney, which is called as a transitional cell cancer of the ureter or the pelvis of the kidney. You can get cancer of the bladder, urinary bladder. You can get cancer of the prostate. You can get cancer of the penis. So all these cancers are also very common problems in urology.
Well, thanks, Doctor. I think it's a great insight what we got on what urology is all about and what are the various symptoms which are there of urology, and also in depth about understanding about how the transformation technology have taken place as for the treatment of urology which is concerned. Dr. Anil Bradoo, exclusive story on ttalk Boond Soch. I think there's a lot of learning for the ttalk audience and getting more insights in depth as for the urology which is concerned. So thanks a lot for your insights for the benefit of a target audience. I'm sure whatever the conversation we're having on this show, there's a lot of things which gets revealed and unfold and a lot of clarity for our target audience. Thank you very much. If you like this episode, series of an conversation with Dr. Anil Bradoo, just go to www.ttalk.net, subscribe, like the channel as much as you can. Do catch up with Dr. Anil Bradoo in our next episode of ttalk Boond Soch. Till then, thank you very much. So thanks a lot for your time on this.
Cheers.
Thank you very much. Thanks.